September is Suicide Prevention Month, meaning it's also an important month for the Salem VA Medical Center. Here to talk about this important issue is Kathryn Mustard, who is the Suicide Prevention Coordinator at the VA. Thank you so much for joining us.
Thank you for having me.
Well, I understand there are special services available at the Salem VA and mental health and suicide prevention. Can you tell us a little bit more about that?
Definitely. The Salem VA has a variety of outpatient and inpatient therapy services. We have outpatient therapy for PTSD, for depression, for substance abuse, for anxiety. There are also inpatient or residential treatment services available for substance abuse, inpatient PTSD treatment. There's also different kinds of therapy available depending on what that vet is experiencing. If they're actively experiencing PTSD symptoms, there's outpatient treatment for that. There's also a residential treatment program for PTSD. And in the suicide prevention program, what we try to do is reach out to vets who potentially could be going towards a crisis and help them access that care and treatment that they need to help them get stable.
So exactly what's the best way for a veteran to get connected with a mental health professional?
If they're in a crisis, the best way is to call the Veterans Crisis Line, and that is 1-800-273-8255. If you're a veteran, you press 1, and that will get them directly to the Veterans Crisis Line. What that will do is then let us at the VA make contact with them and get them connected to what service they may need. And they don't have to be in a crisis. It could be just that they need to get connected to any kind of treatment, and then we call them back and try to make sure that they have something in the plans to help them get that care.
And it's so important to, act sooner than later.
Right.
And I would also think that families could play a part in that as well.
Right.
What if a family member senses there's something not right?
They can also call the crisis line. We often do get family members, loved ones, friends who will call the crisis line for that vet and say, I'm concerned about whoever it may be, and we will reach out. We'll try to reach out to that vet and that family member to try to encourage them to come in for some treatment.
And real quickly, can you tell us a little bit about the statistics? I understand that there are, I guess it's also higher in number as it pertains to vets.
Right.
A little bit more about the statistics here in our valley.
Nationally, they estimate 20 per day commit suicide, kill themselves, and but they also estimate 14 of those 20 are not connected to treatment.
Wow.
So our goal is to get out as much information and encouragement to get the vets what they need. And if somebody is aware of a vet that is experiencing a need for help, encourage them to call, encourage them to come in, encourage them to seek whatever treatment that might help them.
Okay, and if anyone has any questions or need more information, where can they go to get more information?
There's the 1-800 number that I mentioned, the 1-800-273-8255. There's also veteranscrisisline.net, which also has a lot of resources to help vets get connected and help them learn new coping skills or just help them get through whatever it is that they might be dealing with. The crisis line also has a chat and a text feature, which a lot of our younger vets really appreciate because they like the chat or the text versus calling. They can also call the VA itself and say, I need to get connected to treatment, and then they'll get them connected to the right department that they need to go to.
The main thing is to get connected,
right.
To definitely reach out when you need help, and if a loved one, if you yourself as a loved one, to make sure you help
right.
out. Kathryn,
right.
such an important topic. Thank you so much for coming and sharing that with us.
Thank you for having me.
And letting us all learn more about it. Thank you.
Thank you.